Well, there are plenty of health headlines to talk about today. A prominent NBC Sports announcer missed out on a big day at the Kentucky Derby due to an allergic reaction. New plans for weight loss drugs and a new study about marijuana use during pregnancy. So without further ado, our medical expert, Dr. Payal Kohli, joining us now. So let's start with food allergies. Mike Tirico has a nut allergy and recently had an allergic reaction. Yeah. We all kind of heard what was going on during the Kentucky Derby. Is there a rise in nut allergies or just food allergies in general in the U.S.?
We are seeing a lot of kids having it. In fact, it's Allergy Awareness Month right now, 30 million Americans. Do you guys know anyone with food or nut allergies, any kids?
Some of my daughter's friends.
One of our directors here, Lawrence, I know I cooked for him for years. And then he tells me, oh, by the way, I have a nut allergy. I'm like, oh, no. Thanks for letting me know.
So is it peanut or tree nut?
I think he's tree nut.
Okay, so there's some overlap. These are two different types of nuts, most commonly allergic allergies in the United States here. And if you think about the numbers, it's about 2%, 2.5% of kids that have peanut allergies and about 1.8% of adults. And then they also end up having tree nut allergies. And we're getting increasing data that this is happening because of our lifestyles and the way that we're actually feeding our kids early in life. And so there's lots of different theories about why our particularly nut allergies going up. The first is something called hygiene hypothesis, which is that we're a little bit too clean when we're born. So our immune system starts overreacting to anything that it sees, such as nuts. Another is we're not introducing nuts early enough into the kids' diets. And so they say between 4 to 6 months, you want to start putting nuts in. Too much processed food for our kids changes their gut and the way that it works, and that can sensitize them to allergies. And one that I didn't know about, probably true in my niece because she has tree nut allergies, she has a lot of eczema. So her mom was using a lot of almond oil on her skin. And so even using those nut oils can cause absorption and sensitize the immune system.
Interesting. I was going to say, we have a 13-month-old at home. One of the things we were told by doctors is if there's no reaction, like keep feeding him peanuts. And so we do peanut butter on everything.
Yeah, and that really teaches our immune system not to react. And it's very regional. So United States, we tend to have more nut allergies, but it's something we have to be careful about. If you're sitting on an airplane and eating peanuts, chances are at least one adult on that airplane has a severe anaphylactic allergy to peanuts.
In fact, I've seen less and less peanuts being offered on airplanes, perhaps because of that. So another headline we want to get to, the World Health Organization plans to officially back the use of weight loss drugs to treat obesity in adults for the first time. So why is this significant, according to you? And do you have a strong opinion on it, or?
Yes, I mean, this is huge. We have been waiting in the medical community for the WHO to come on board. In fact, in 2023, they said they're not going to come on board. So this is a complete 180, and I'm so happy to see that. 1 billion people in the world have obesity, and 70% of those live in low to middle income countries. And you're talking about the obesity medicines having a price tag of $1,000 a month, being accessible only to the wealthy, essentially making this a disease that only rich people can treat, and not most of the world where the obesity lives. So I think them acknowledging that this is an important part of the armamentarium, the fact that one of the medicines, semaglutide, is going to go generic potentially next year, and the fact that the WHO is now coming on board with using medicines to treat obesity, I think it's going to change the landscape of how we think about treating disease around the world.
Does it lower prices, though?
If it goes generic, it does, because then competition comes in. So when a drug is under patent, which is usually about 7 years after it gets FDA approved, they can charge whatever they want. And people can only make it, those compounding pharmacies were making it by reverse engineering, taking it and trying to sort of reverse engineer it. But as soon as the patent gets released, you can start making more generic versions. So the idea is a paradigm shift in medicine. It's thinking about obesity as a disease, thinking about it as a disease that everybody should have access to treatment for, not just the wealthy, and really changing how you think about managing this condition.
Very quickly, let's talk about this study with marijuana and moms who are pregnant.
Oh my gosh, it knocked my socks off because I didn't even think that many moms smoked during pregnancy, but about 5% of moms smoke marijuana during pregnancy, even though they know they're pregnant, and that number has doubled in the last few years. And what the study showed is that moms who smoke during pregnancy have a significantly higher rate of prenatal outcomes that are bad, including low birth weight, including preterm labor, but most importantly, including death. And so there's a 29% higher risk of something bad happening, because when you smoke the marijuana, you're damaging the baby's lungs. They're not developed normally, and you're displacing oxygen, and you're you're absorbing the marijuana through the placenta, which is feeding the baby. And so I really hope this is a wake-up call, not just for smoking yourself, but even secondhand smoke. If you're pregnant or think you might be pregnant, you really want to avoid anything with marijuana.
Stay away as much as
I
you
know.
can.
You have to. You have
Yes.
to. I mean, you're losing your baby's life.
Exactly.
And sometimes the baby is born alive and then dies soon after pregnancy.
I'm glad you're saying it, Dr. Coley. I'm glad that, hey, the more you know, right? Dr. Coley, thank you so much.